He reigns, he reigns, he reigns. We give glory to the Lord. He reigns. We give glory to the Lord. He reigns. We give glory to the Lord. He reigns. He reigns. He
Hello. Hello.
reigns.
Hello.
He reigns.
Hello. Hello.
We give glory to the Lord.
Hello.
Yes, until we can hear you.
Okay. Okay. Thank you. Thank you. We give glory to the Lord. He reigns.
Um,
Yes.
we can be
We
a
We
give
give
glory
glory
to
to the
the
Lord.
Lord.
Zoom
He
in.
He
reigns.
reigns.
Bo,
He
He reigns.
I
reigns.
mean, yeah, about
He
the next,
reigns.
but
He
He
reigns. We give
give
glory
glory to
to the
the
Lord.
Lord.
He
He
reigns.
reigns.
Oh, he reigns. He
He
reigns.
reigns. He
He
reigns.
reigns. We give
Glory
glory
to
to
the
the
Lord.
Lord. He reigns. Hallelujah.
Amen.
Shall we have a word of prayer? Our Father, Lord, we are most grateful unto you for a time like this. We thank you, Father, for gathering us for this important meeting. We give you praise, we give you glory, we give you honor and adoration. Father, we present to God the speakers unto you, and we ask that, O God, you know, oh God, Father, this meeting even before it was organized, oh God. So we pray that, oh God, you speak, oh God, Father, through the speakers unto the hearers, oh God. All of us, oh Lord, that Father will be well prepared as the children prepared to go back to school. We want to thank you that you are a God and you answer prayer. So you have heard us, oh God. We ask the Holy Spirit to take full control over everything. We silence every power of darkness, and we ask that all um the Zoom meeting will be successful. We will not have any problem with hearing and all the itches here and there. We pray that everything will be successful from beginning to the end. Holy Spirit, take full control, have your own way in our midst, that at the end of it, glory and honor will be given to your name. We thank you, we bless you. In Jesus' mighty name, we pray with thanksgiving. Amen.
Amen. We thank the Lord for such a day and a time like this. We are very opportune to have our wonderful panelists to join us, to educate us, to inform us. Um, First, we have Dr. Maria Wasilowski. Dr. Wasilowski is an associate professor of medicine specializing in infectious diseases at UMass Medical Center in Worcester. She was trained as an infectious diseases specialist at UMass, and she also earned her master's in public health at University of Massachusetts Amherst. She was born and raised in Venezuela, and she completed her medical school at Universidad Central de Venezuela. Dr. Wasilowski's major focus have been treating patients with HIV and hepatitis C and B. Most recently, she has been involved in clinical trials to find the best therapy for COVID-19. She's also the medical leader and director in the antibiotic stewardship program at UMass Memorial, and is part of a very dynamic and intense group of consultant physicians for general infectious diseases at the health system. She enjoys outdoor hobbies such as hiking, biking, and running. She also likes to read and share her knowledge every Saturday during radio programs, not only in Worcester, but across the country. She is someone who is very invested in communities to ensure that any and all are educated to ensure, especially during this pandemic. She has championed the COVID research, ensuring that what is needed, the knowledge, the wisdom, the intellect needed, so we are able to protect ourselves. She is not only keeping it to herself, she's sharing it. And we are honored to have Dr. Weslowski in our midst today. We also have Mrs. Heidi Pollock. She is an educator, she is a community advocate, and she brings very much passion to the table as well. Ms. Heidi Pollock is entering her second year as the interim executive director at PIWC Foster Charter School. PIWC was opened in 1998 and is the oldest charter school in the Commonwealth of Massachusetts. PIWC serves over 1,400 students in kindergarten through 12th grade. Most students come from Worcester, representing a diverse background. More than 80% of the student body is non-Caucasian. PIWC is best known for rigorous academic standards, strong character virtues, and an emphasis on partnership between school and families. Heidi came to PIWC after having served as chair of the board of trustees for nearly 10 years, while her volunteer time was dedicated to leadership of PIWC. Heidi spent her professional time working in the city of Worcester at local nonprofits such as Girls Inc. And Heidi has been working to empower young women, young girls to be confident in our community. She earned her bachelor's in political science and a master's in education, both from Assumption College. She also obtained her provisional license from the Commonwealth of Massachusetts as a superintendent. Heidi and her husband are proud parents of 2 PIWC students. Her daughter Abigail is now entering her junior year at Emmanuel College in Boston, and her son Benjamin is entering his senior year at PIWC. They reside in Worcester with your dog and Siamese cat, a hamster, and an African pygmy frog. Let's please welcome our wonderful panelists, Heidi and Maria. Dr. Weslowski and Mrs. Pollock. Thank you.
Thank you, Vivian.
Thank you. We'll also introduce our moderators, Deacon Jeff and Mrs. Michaela Agassi. Please take over. Thank you. Welcome, everyone.
Hello. Thank you for having us here tonight.
The pleasure is all ours. We're very honored. Thank you. So Uncle Jeff and Auntie Mickey, if you're on, please take over.
Okay. So welcome, everyone. I believe we're going to have a wonderful time. Thank you to our panelists for responding to us, for taking the time out of your busy schedule to be here with us to educate us. We're going to do in this form. I will let our panelists do their presentation. Then after that, if you have any questions, you can send it to us privately on the chat, or you can send it to my number. So just put it on the chat or send it to my number. They can send, okay, they have the chat access. Okay. So you can send it privately to me, please, if possible, to me and Auntie Mickey. Okay, so we can read the questions out, but we will let them finish their presentation. If you have any questions as they talk, just jot your questions down, and when you're ready, they can answer our questions for us. Okay, so let me put my number on the chat. So if anyone wants to send it directly to me. Okay. Or you can just put it privately in the chat for us. Thank you. All right. So over to you, Miss Maria and Miss Heidi. I don't know who is going to start first, but please, you have the floor.
I will let the good doctor go first.
Okay.
Well, thank you, and welcome everybody to this and I really appreciate the invitation. As Vivian was saying, I've been working with the COVID since the beginning. I think the HIV epidemic of the 80s and 90s trained me to be able to handle another pandemic. That wasn't a pandemia, an epidemic, but this definitely was something that we were expected with the flu, the influenza. However, it wasn't influenza, it was the coronavirus. If people remember, in 2003, we have another SARS or another COVID, but it came and went away, thankfully. And it was also originated in China, and it spread some cases in Canada, but it really did not evolve to be what we have right now. When the coronavirus type 2 came, I think it was recognized in China at least immediately to be a threat. And it really took over and it spread, as we all are aware now, that is global. And that's what pandemia is. Pandemia is when you have cases that it's not only local to one country, two country, but when it's globally and affected in a big way. So it's not that we never had, the humankind has never been encounter a pandemia. We had before the pandemia of the influenza, or what we call the Spanish flu, which was a new strain, a new variant of the influenza that spread for over 2 years and killed. And this is an approximately 20 to 50 million people. Just to have a perspective, in 2 years, it killed 20 to 50 million people. When we say that, it's because in the world, and I'm talking about the world, there was not at that time, and we're talking about 1918, 1919, so 2 years, and it was the First World War was happening too. So there was no way that they were having a good epidemiology to know how many people were dying. But the estimation is between 20 millions and 50 millions. In any case, just for everybody to have a perspective, right now we have about 4.5 million people in the entire world that has died from COVID. Now, we have not finished. I think everybody knows that we're still having cases, and has been now, some of the places has been put off the fire on it, and it come back and it disappeared and it's coming back again. What make it to come back? New variants, and it's happening as we speak. So we had the wild type, the variants that has, been with us since the January or February of 2020, but then we start seeing in the summer some variants that happen in UK, South Africa, Brazil, India, etc. But the new strain that has been of concern is the Delta, which everybody's talking about. And what is particular is that this virus has the ability to have much higher replication. When I say replication, is have babies in a much faster way. And also, due to that, it spread faster and it spread very easily, because when you sneeze or when you talk and you have that variant, it will spread much higher number of viruses. So that is why these particular variants is of a concern. And from the clinical part, or from the hospital, what we have seen is that due to probably the vaccination, we see younger people, and the majority, 97% of the new cases that we have, 97% are people who has not received the vaccination. Not only they're younger, not only that they become sicker faster. So that's the thing. They have so much virus in the nose when they get it, because the spread is much higher number of viruses, that then 2 days, 2 or 3 days, they ended up in the hospital. We did not see that in the new or in the original variant. They were coming 6-7 days after they had acquired the infection, With these new variants, the Delta, we see patients coming much faster to the hospital. They're younger, and things that really are of concern is many children now are being hospitalized and also in the intensive care unit. And yes, people between age 40, 50. So at the beginning, when we have the initiation of the pandemic was mainly older with a lot of comorbidity. Right now, what we're seeing is unvaccinated, healthy, otherwise coming younger in the age of 40 and 50. Unfortunately, for example, today we had to initiate treatment for 2 pregnant women. And I tell you, pregnant women with COVID is not a good picture. When I say this, it's just to initiate the how can we try to control a pandemic. So historically, and it's always been the case, and it's always will be, you need to isolate patients that are contagious to others. You do that all the time. It's not a secret. It's not something that we are just making it up. It's not made by the Democrat or Republican or whatever. It has nothing to do with that. It's what we have done in public health. You isolate the person who is sick, and then you try to isolate as soon as you can anyone who has been in contact with this and being isolated. Now we call it quarantine. It's because quarantine is like 40 days. We are not using 40 days. We're using, in the COVID, we use 2 weeks now, 10 days. So we need to isolate it, and that way they don't spread it. So the other thing that we are, because you can't walk and say who has it, who doesn't have it, is to have social distance. The social distance 6 feet away, and children 3 feet away. And there's also demonstrable cases and studies showing that that's how you can separate the spread from one to the other. The use of mask is also another way. Many people has brought the concern that the mask is going to cause them to have less oxygen. Guess what? That's not true. Absolutely not true. As a matter of fact, we need to actually take more CO2, which is carbon monoxide, a little bit more. Many practices of wellness are trying to make that you are breathing less per minute because we need to incorporate a little bit more of CO2, and the masks are doing that. So anyone who is afraid that they're not breathing well or whatever, no problem. They're becoming more healthy. I'm not saying that we have to wear masks all the time, but it's not making you less healthy. Psychologically, maybe the fact that you cannot see the face, that you don't recognize people that were like, it may have an impact, but this is not going to last forever. This is going to go away. All pandemia go away. And that's the hope. Now, the faster we can contain people who are infected, the faster we can treat them, the faster we can prevent new cases, the faster we're going to see the resolution of the pandemic. What happened is that, and we had a vaccine, and we still have the vaccine. And I'm going to talk first about the first 2 that were approved with an emergency use authorization. Because of the pandemic, they had to accelerate without cutting any corners about the safety. They just wanted to obtain more longitudinal information to get it approved definitely. And I can say that in few weeks, we're going to have that by the FDA. Pfizer first and Moderna after are going to be finally with the FDA approval. This vaccine has been tried in the SARS-1, Ebola, Middle East, but they didn't have that many patients to make it to make this vaccine safety to say, okay, you are approved for this Ebola or for SARS or Middle East. But they had a lot of evidence that it was safe in terms of reactions. Protection, they could not get the power statistically to say this is a very good for Ebola or for the SARS or for the Middle East respiratory syndrome. So that's why they were not approved at that time. What has the COVID done, because we have so many cases and is so enormous the amount of patients, we were able to obtain a lot of information very fast and very evident that is very safe and more important, very effective to prevent that you ended up in the hospital and die from COVID. It doesn't prevent you from probably getting some of the virus in your nose and passing to others or to become sick. So I want to make sure the vaccine doesn't 100% prevent you from getting sick. You may get sick, but if you get sick, it's going to be a very mild illness unless you have other problems. And you may not, and for sure you're not going to die. That's what we saw in the initial studies. And when I say so, I have to say, and I have to, that we were part, UMass were part of the study, and I participated, enrolling a lot of these patients in the study, and we follow them. So I know for a fact that it's very safe and it's very effective. We did not see in our 200 patients anyone who got COVID during the much higher census that what we have. So right now, the school is coming, and I know that you want me to say a little bit about that. And they are, I think in Massachusetts, we have no debate that they're gonna probably post to use mask. I know many colleges and many high schools and schools are recommending that. And I think it's appropriate. I think it will be for the good of the kids, because the majority of them, less than 12, they are not vaccinated. So older than 12, they can be vaccinated. And for sure, it's something that I would recommend. And that way they can be a little bit more comfortable that they won't get it. And you won't pass it to other as much if you were unvaccinated. But younger than 12, we don't have yet the authorization to vaccinate them. Therefore, they can carry the virus in their nose, they can pass it to the family, they can pass it to another kid that is unvaccinated or vaccinated. So we still highly recommend the use of the mask in school. And I think if they are having some distance, that it's also important, and having some plastic shields and whatever, I think it will be beneficial as well. Remember, you control the pandemic by isolating, preventing to get infected. We have a vaccine. What happened in the pandemic of the Spanish flu, not only they did not have ventilators, they didn't have vaccine, and they didn't have what we now have, monoclonal antibody, remdesivir, and many other medications that I can attest that they're being tried as experimental drug to see if we can find something that will kill faster the coronavirus. The vaccine, what it does is create antibody that already you have in your body, and they will protect you because they neutralize the virus. They neutralize your virus if you ever get infected. Therefore, you won't have a way of getting replication and feeling awful. That's why the vaccine is quite important. The RNA vaccine, Pfizer and Moderna, are RNA that never get into the DNA. And I'm saying that because many videos from doctors are saying that they're going to do a genetic experiment, that they're trying to, so many conspiracy theory that many of them laughable, I have to say, that with all the respect, they're very laughable because they don't know the science. RNA cannot go back into the DNA, so you cannot do that, and it's not going to affect the DNA. We have now almost a year of people being vaccinated, and nobody has extra, they don't have a tail, they don't have horns coming out or extra fingers or anything like that. Many people have said that they're going to become infertile. There is no way you can have that for boys or girls, so that's not true. So I really think that we need to get more informed about all this conspiracy theory and avoid this misinformation, and try to hear it from, you know, the science. And people say, well, maybe they're just not true and whatever, but believe me, I know the science, and it's really effective and really good. So with that, I'm just gonna, you know, I don't know if anybody has more question, given some time also for for Heidi.
Great.
Or if you want, I can keep talking, because I can keep talking. It's up to.
That was very informative and reassuring, and reinforces a lot of what I know as well. So thank you for all of that. And like the doctor, I am humbled that you asked me to be part of this tonight. I think the best thing we can do is share information and have these types of conversations and questions, and be able to inform each other about, as the doctor said, what is actually science and not just what we're hearing on social media. So I'm coming at this from a school perspective. As Miss Vivian had said, I've started here at Abby Kelly. And over the last year, I had the pleasure of bringing back students into school. And I have to say, I can't imagine a more important and fearful job than asking parents to trust us with their precious children to come to school to learn in a pandemic. I took that responsibility very, very seriously. And as Miss Vivian said in my bio, I am also the parent of an Abby Kelly student, my son, Benjamin. So I knew what I was doing was not only for my son, but it was for all 1,426 students that I consider like my children. And so I share that because I never, ever want parents to think that we are not putting their child's health and safety at the forefront of the decisions we make. That being said, last August at this time, there was a lot of things we did not know. Every month, we sort of learn more about this pandemic. And back then, I will share one of the things that we thought, which was, don't let anybody in the school buildings, because if that person comes in and they have COVID, then we're going to have to close the whole building. Now, we know now that that seems very, very ridiculous and very, very silly. But at the time, we didn't have enough information. It was still evolving. So we made some decisions based on that information. We know now that if somebody were to come into our building, a visitor, a parent, a volunteer, whatever the case is, a teacher or a student, and they had COVID, that we wouldn't shut the whole building down. We would isolate who they were in close contact with. We would make sure that they were tested, and we would follow those proper protocols. So I share that as an example because we are continuing to learn information as we go through this. So what are some things that parents can be doing, and what, if you don't come to Abby Kelly, what you could be asking of your child's school? Because I think we can expect that our school leaders anywhere across this country, in the world, should have the health and safety of our students at the forefront. And if they're following many of the same protocols that the doctor mentioned, then we would be keeping them safe. So for us here at Abby Kelley, our first priority was masks. We understood how important making students, staff, anybody in the building wear masks, how that was going to help lower the risk of transmission. We socially distanced. We made sure that the desks were spread apart, that the students alternated rows when they were eating lunch. So row A ate lunch, row B kept their mask on and read a book, row C ate lunch, row D kept their mask on and read a book. And then halfway through lunch, they switched. Row A and row C put masks on, read a book, row B and row D ate lunch. So that was one of the practices that we put into place to make sure we were minimizing the risk. I don't think anybody's going to tell you that we can get rid of the risk altogether, because that's not true. So we understand just living life has a risk to it. So we have to wear a seatbelt, go the speed limit, look when we're crossing a street. Those are all things we do to minimize a risk of getting hit and getting hurt in an accident. This is no different. They're not guarantees, but they are to minimize the risks. That being said, we talked about wearing masks. We talked about social distancing. We know that keeping our hands clean, either through hand washing or hand sanitation or hand sanitizing with an alcohol-based hand sanitizer, also prevented the spread of the germs. We limited what students touched. So for a period of time, we didn't even let them share a ball at recess, because obviously you would be throwing the ball back and forth, and you're not going to hand sanitize in between catching and throwing the ball, right? They're kids. So we now realize, and we now know, the science says it doesn't really live on items. It doesn't live necessarily on a pen that you might pick up. It doesn't live on a ball. Those are not things that are going to spread it easily. Now, if you were to pick up the pen and chew on it and stick it in your mouth, yeah, you're probably going to get some germs. Not recommended. But we now know the science didn't support all of that extra. Don't touch anything. Don't share a crayon. Don't pick up the same book. Don't use a block. That really wasn't the case. If students washed and sanitized their hands coming in at the beginning of the day, certainly at various points throughout the day, after lunch, maybe if they were out at recess, that absolutely mitigated some of the chances of spreading it. So mask wearing, hand sanitization, social distancing, and then at night, we instituted a very strict cleaning protocol across the whole building. Our cleaning protocol actually had been in place before COVID. If you recall, there were, and again, the doctor mentioned, there were times when really bad winter flus or colds or I think it was, I want to say the norovirus, it's a stomach virus that goes through, large populations, whether they're cruise ships or nursing homes or schools. And so sometimes there are outbreaks. And so our school was prepared and had a very safe but effective disinfectant that we sprayed. It looks a little bit like a backpack you put on, and it has a nozzle. It is food grade safe, meaning there's nothing in it that would cause harm to you, but it falls on all of the surfaces and sterilizes them. Hospitals use a very similar kind of product when people are in and out of hospital rooms. So we had put in place all of those protocols from day one, starting for last year. we made a decision to bring our students back as soon as possible. That was not the same decision that other schools made. For us, we recognized how important it was for our students to be in school, not only to learn, but to provide them meals, to provide them access to mental health counselors or teachers that they had were trusted confidants, to their friends, to activities, and really to not have our students sitting at home by themselves while their parents, many of which were frontline workers, had to work. So we wanted our students in school as soon as possible. At Abby Kelley, we started off with our littlest learners. We felt our kindergarten students and our students in grades 1 through 3 needed to be back in school sooner than our high school students. Not that they didn't need to be back, but if we were going to prioritize, that's the group we did. So we were able to get back all of our elementary school students in the fall. We have 420 elementary school students in grades K through 3 in our elementary school. We had approximately 300 of those back in person when we opened up. We did not have one single transmission of COVID between student to student or staff to student. So all of the people we had, and in the end, last year, we had about 750 of our 1,400 students. As you get older, it was harder to get the older kids to get out of bed and get off the computer and come to school. So that was just a fact. But as the year went on, we had more than 700 students, and we had all of our staff in person from day one. So they weren't working at home. They were required to come in the building, even if they were teaching online. So of all those people, we had 49 positive COVID cases. And that was the entire year. So from August through June, we had 49 cases. Did we have close contacts? Yes. Did some people have to go into quarantine? Yes. But did it spread? Absolutely not. So let's say I came to work on Monday and I had been pretty unsafe over the weekend. I went to a bar, I went to a party, or I went to a cookout, or whatever the case was. I came into school. I developed a fever by noontime on Monday. And I had been in a classroom of 10 kids. Now, because of the social distancing rule that we put in place, you couldn't really and shouldn't be next to each other for longer than a handful of minutes. So we tried to really impress upon our staff, if you had to go help a student, you needed to do it and then move away. And the CDC, all of the Department of Public Health, Department of Education, all agreed that a prolonged close contact or a close contact was someone who you were next to for more than 15 minutes, okay? So we were very careful about making sure that we didn't stay in small groups less than 6 feet with each other for longer than a few minutes. That helped keep our transmission rates down. So I come in, I might have a class of 15 students, but I didn't really spend a lot of time with each of those 15 students. But you know what I did? I grabbed coffee with my coworker on the way in the morning, and we talked for 10 minutes out at my car about my weekend. She would also be a close contact. But again, we really enforced, if you were on the property, you had a mask on. So you were social distancing, you were wearing your mask. So they may need to go into quarantine until they got a negative test, because that was the way to come out. but I never transmitted it to another student or my colleague who I had coffee with out in the parking lot, because I stayed 6 feet away and I wore a mask. And I can't say that enough, because I can assure you, out of the 49 cases, so I would have been one of those cases, I got it somewhere else and I came to school. I got reported as being an Abby Kelly case because I work at Abby Kelly. So they were trying to keep track of all the cases in the school system. If I worked at Subway, nobody would know if I had COVID. They only knew because we were in a school, and they were keeping very, very close track of those numbers. So again, we had to report everything to the state. Every time somebody tested positive, that had to go to the state. That was the 49 individuals, students and staff. And I can say every single one of them got it from somewhere outside of the school building, and it did not spread within the school. So I can say with very, very high certainty, masking, sanitizing, cleaning, and social distancing were all things that worked for us last year. We are going to use many of those same things to open school this year. We are mandating that masks are being worn, even if you are vaccinated. I think it is a moral imperative to help others as well as ourselves. And as the doctor said, it doesn't guarantee, the vaccine doesn't guarantee you don't get it. It just helps make it a less severe case. I want to make sure everybody is safe, and I don't want anybody spreading it or feeling unsafe. So everyone is going to wear masks, staff and students here at Abby Kelly. We are going to continue with our hand sanitizing, our cleaning protocols, and other ways to minimize the risk. I will say right now, the one thing that is going to change this year is the social distancing. And it is honestly a thing that I wish we could keep, but we don't have the space to have all the students back in school and have them 6 feet apart. We just don't have that space. So we know the state is telling us there is no remote option this year. So if you are thinking you are going to elect, no matter where you go to school, you're going to elect to put your student in remote only or keep them at home for as long as possible, that is not an option. As of tonight, there is no remote option. So we couldn't even give that to you if we wanted to. Everybody has to be in school just like they were in 2019. And that is probably the biggest change. So if everybody has to be in school, I need space for all 1,426 students. So I'm not going to be able to spread their desks as far apart as possible. What I am going to do is work with the teachers, make sure they understand about keeping students apart when possible. And we're not going to put students right next to each other. If they're sitting at a table, for example, there's going to be a piece of plexiglass in between them. So we are going to continue doing what we can with the space constraints we have to minimize people next to each other. But again, if they're wearing masks, it's really important to know if 2 people are wearing the mask, you are going to have a very hard time in transmitting that virus, even if you are next to each other. So I know it works. It is what I am basing this year on. And like I said, I have the statistical evidence that it worked for us last year. There are a couple other things about what you can do. I can't agree enough about the vaccine. If you're eligible to get it and your students of age 12 and up are eligible to get it, please do. The doctor gave lots of reasons why it is safe, and we're not going to be able to contain this unless we actually get to that point of having most people vaccinated. I did not grow up in a time when polio or measles, mumps, other very whooping cough, other very, very serious diseases existed. And I'm fortunate that I didn't have any of those things because I got the vaccines when I was a baby, because that was what they did. And they still do that. All of you who have children know that you needed to go and get the vaccines when they were 2 weeks old, 3 months old, 6 months old, 18 months old, etc. You need those to come to school. Chickenpox, measles, mumps, rubella, meningitis, all of those things have safe vaccines that allow you to not have those illnesses. This is one more thing. And I wish people understood that, and that the science that for decades has helped us be smart and safe here in the United States because we have these vaccines. This is one more of those. And I get it. I understand how scary it is and it's new. But I think we have to think about it in terms of other things that have happened in our history and how we've been able to really stop the spread of those because of it. So absolutely encourage people to get vaccinated if they're eligible to do that. The other thing is really working with your students and your children about not coming to school when they're not feeling well, staying home if you've got symptoms. It does not help. I am a mom. I'm a working mom. I get it. I know how hard it is when they wake up in the morning and they got a sore throat and a little bit of a fever and you're like, I got to go to work. I don't have anyone to watch you. I'm going to give you the Tylenol and I'll wait till the nurse calls me, because that's easier for me to get out of work if I say, oh, the nurse called, than it is for me to call and say, hey, I got to take a sick day. I get it. I understand. But we're playing with people's lives here, and we should not take that chance, including your own child in your own family. Don't send them to school if they're sick. This whole thing has taken a village to get together and try to figure this out. Find people that you can trade off with who might work different shifts or who have other resources. It is horrible. I get it. I really, really understand, but it does not help if we're sending sick kids to school and are infecting others. Have grace when your teachers are out sick, because we don't want them to come to work. We don't want them to bring it to school. Yes, a substitute means one less day your child's going to learn something exciting. I understand. But over the next couple of years, or until we get this under control, we have to give each other grace, and we have to do that. I am sure whatever your employer might be, if you explain your child has symptoms, they don't want you at work any more than they want your child in school. Like, trust me, okay? Nobody wants people coming out sick. So please take that under consideration. Don't send your student to school. Don't go to work if you're sick. Let's keep these as contained as possible. And be aware of who you're around with. When the contact tracing happens, really pay attention. Who was I with for more than 15, 20 minutes? Was I in that room? Was I having a conversation? Was I more than 6 feet apart? Those are all very important pieces of information to hear and know so that we can make sure we are isolating. As the doctor said, we got to isolate that risk. And so that's also very important. I could also go on for hours about this, but I would much rather answer specific questions that all of you had. I just wanted to share a little bit about what Abby Kelly did last year, how we were successful in having people back, no transmissions from person to person in school, and what we're going to be doing to come back again this year. So I can stop and turn it over to the moderators.
Okay. Thank you very much. Thank you very much. So please, if you have any questions, just keep them coming. First question that someone asked is if you're not guaranteed not to get sick from the vaccine or not to get the virus, why are we encouraging the vaccine? So if Dr. Maria can answer.
Yeah, so this is a good question, right? Why to get the vaccine if there is a 3% chance that you may get infected? So if you have a 3% chance, which I think the math is pretty clear, you have a much lower probability of getting sick, only 3%. But if you ever get sick, you won't end up in the hospital, you won't die. So I think those are two super important things. And your illness will be very mild. We've seen it. People vaccinated, they have gotten, and we knew that because when you say 90% or 97% effective, we knew that there is not 100% protected. You have 3% that will end up being sick, and you say, well, but it's not 100. Nothing is 100%. I mean, I wish everything is 100%. The same thing with the seatbelt. You get in the car, you put your seatbelt, right? You try to protect yourself of not going away. It's not going to protect you from having an accident. It's just trying to avoid that you don't have much more severe injury. And I can give on and on, cases like that. So the chances for you to get infected is much lower if you're vaccinated than if you're not. So that's the reason everybody should get vaccinated. I have to say that when some people come to me, well, the side effect, I said, listen, I'm sure, how do you get here? Oh, by car. Okay, when you went into the car, the chances of you dying of an accident in a car accident is much higher than dying from a vaccine or having complication. But nobody doubts in getting into the car. Either you drive in or somebody else drive. So it's a matter of managing your risk. Everything in life is a risk. There is nothing there is not a risk. Eating in a restaurant, you can get poison. You going with a car, everything, getting into the airplane, walking. We are going to die eventually. But what I'm trying to say is, please measure your risk. The risk of dying from COVID is much higher than getting vaccinated. A side effect from the vaccine. Getting COVID is not a pretty picture, believe me. Now we're dealing with what is called the long haulers, and we don't know what to do with them. Believe me, we don't know what to do with those who are chronic fatigue, brain fog, chronic cough. I'm not feeling well. I'm super tired. It's if you have something that will prevent 97%, God. Now I have to say, as people get infected, they're creating new variants. That's how we got Delta. That's how we got the Alpha variant, the Beta, whatever variant. I mean, and we're going to get much danger one. So if everybody's not vaccinated, we're going to get one of those coronavirus that nobody wants to have. So please don't do it for yourself. Also do it for the community. Do it for the community. Do it for everybody who lives in your house, and also in the community, in your church, in your school, and your work. I mean, think about that. You don't want to pass it to other people. So, and again, we want to end this pandemic. It's not nice. I have to say, we're starting to see numbers tickle up again. We already converted one of the ward at UMass again into COVID. Today they announced another one. We know it's coming another surge, Delta. And okay, we're gonna resolve Delta, and it's gonna be another one, Epsilon, whatever Greek name they're gonna have, and it could be much more dangerous. So those who are not vaccinated, please do it. I can attest that many of the patients that I've seen since December and here that are they're unvaccinated, they wish they had been vaccinated. They wish they had been vaccinated.
Thank you so much, Dr. Wesolowski. I have another question for both of you. Now, many parents are concerned that the states and the schools may be mandating that kids 12 to 17 really get vaccinated before they come to school. And that is worrisome to those who have not yet decided to get the vaccine. What can you say about this?
Well, again, I have to say that if you have something that will protect you, you get fined if you don't wear your seatbelt. If the police stop you and you're not wearing a seatbelt, you get a fine. So the mandate to use the vaccine will impair you, obviously, not to go to school, which is an important activity. But I think, and I'm pro mandating. I'm pro that. I think we need to have that. Otherwise, we're going to see a monster of you can't believe. And I don't want that, because we are the one who are dealing with that. And it's miserable the way COVID has treated everybody. I mean, we have lost people, we have lost job, we have changed the economy, we have changed so much. And the fear for the vaccine is, I don't think, outweighed all the things that we have seen. So I don't understand, but and when I say I don't understand, it's just that maybe because I understand that the chances or the risk of having COVID and all that is so much higher than the side effect from the vaccine, that I don't understand. I really don't. I think it is imperative that we control this, and if it requires mandate, so be, because it's something that we are affecting. People who are unvaccinated are affecting the humanity. They are affecting that we continue to live this way. So I think we need to enforce it. I mean, we enforce many things. We enforce that you have a car insurance. You need to have a car insurance, otherwise you cannot register your car. Is that true? We enforce that so many people need to have certain things to do things. So this is a pandemic. This is life and death. So I think it should be mandated.
I would say maybe it requires a shifting of your mind, because you're only going to get mandated and it is going to feel forced if you don't choose to do it in all of these months where it is available. So it is, this idea that, it may be mandated, which at this moment it is not. So again, it's not. But shifting your mindset. If I do this now and I learn and I read and I listen to trusted people and I take my children now, I'm doing it on my terms. I'm doing it now. I am not going to feel like I was forced into something in December or January if it becomes a mandate, because I am making that choice now. So I think it gets, I think people have to really think about, if you want the choice, you have the choice right now. Do your research, listen to the science, listen to what's happening, and go and do it. Then you're not going to feel like you're being backed into a corner and you have no choice, because you do have a choice. and it is the right thing to do. The other thing, I was just going to say, going back to all the other vaccines, you had all of your children vaccinated when they were born and all those months after, because you wanted them to be safe. You knew that these were things that were going to make them safe. Again, there's no guarantee. The doctors give you a piece of paper that say there's a risk of fever, there's a risk of a rash, there's a risk of this, but you still did it because that outweighed all of the seriousness of those. So again, I just ask you to reframe your mindset so you're not feeling like you're being mandated. But go ahead, doctor.
No, I agree, and I apologize for cutting you off. But I think that, look at it this way, 9/11 happened, and guess what? Everybody now have to go through.
Yeah. Oh, she froze.
Yeah.
But she's right.
Oh,
yeah. Go ahead.
I'm sorry. I was saying that you cannot get into an airplane and say, I choose not to be screened. You have to be screened. I mean, it's for safety of everybody else. And they want to make sure that everybody getting to the plane has no gun, has that, whatever. And so the same thing here. If you want to go to school, if you want to go to work, they are starting to mandate, say, if you want to work here, you need to be vaccinated. And the same thing. I mean, if you get into the airplane, you need to, and nobody say anything, So I think we need to understand that probably that's coming because people are not, we wanted to have everybody vaccinated by July 4th. That was kind of the promise of about 80% or 75%. We did not get there. Unfortunately, now we're seeing a surge. And believe me, the surge is from unvaccinated. So the surge is going to cost us again. Hopefully not to close back, not to lose again. I mean, I don't want to go backwards. So I think that people need to understand the only way that we were able to control the second surge is when we start vaccinated. It was beautiful to see how things were really under control. And right now we have it. You can walk anywhere and it's a walk-in practically, and you can get vaccinated. So I really commend everybody to do it.
Thank you. Thank you very much. The next question which came in is about monoclonal therapy and remdesivir. Are these substitutes to the COVID-19 vaccines?
So absolutely no. The vaccine protects you of getting ill. If you get the disease, if you get the infection, and you ended up in the hospital, then you have the option that you have treatment right now with remdesivir, which was approved. And the monoclonal is for people who get and they don't need oxygen, so they're not too sick. So remdesivir for people who are in very sick, requiring oxygen, and monoclonals are before the oxygen. Let's put it this way. And so the monoclonals are antibody that were produced in a experiment in a research lab, and there's a clump of a lot of antibody that they inject on you. They infuse it. Now we have subcutaneous too, and it's one single infusion, and it's to try to do what the vaccine would have done if you had received the vaccine. But now you're sick. Now you need something to try to neutralize the virus and see if you can get better faster. And the science proved that it seems to be that way. Now, not everybody can get monoclonal because we don't have enough. So the only people who can get monoclonals are 65 and older. They have a comorbidity, meaning that they're a heart condition, they have diabetes, they have asthma, they have COPD, or immunocompromised for some reason. It's not for, Joan Smith, who is passing by and is 30 and has no comorbidity. So think that these are limited resources for treatment, and monoclonal so far is one of them. We don't have enough to give to people in the way that is coming. It's coming furiously, and you know that by the news. I don't have to tell you that.
So the next question is, when is the best window to get this monoclonal therapy? So if somebody walks into the emergency room and has test COVID positive, and they just on room air, but they are sick, are you going to give it to them right away?
So like I just said that we don't have enough to give it to everybody. At UMass, for example, we're doing research and they don't get it right away. They get it the next day. So they go home and then they get a call. Hey, come back. You can get the monoclonal. Many people we found they don't want to come back. They just want to stay home. They don't feel that sick. And so no, you're not getting it right away. We don't have the support to do that right now. There is a station in Hanneman campus, Lincoln Street, where they're doing about, I think, 8 to 10 per day, but you have to have core morbidity. You have to have conditions that I mentioned that you know, they will impose some risk for you to become hospitalized.
Thank you.
So the other question that came in was, we know we have the Moderna vaccine, the Pfizer, and the Johnson & Johnson. But I think in a couple of months ago, we had some issues with the Johnson & Johnson. So what is the recommendation? Because I think there was about 60% efficacy for the Johnson & Johnson, but Moderna and Pfizer was a little bit higher than that. Are the doctors still recommending people to get the Johnson & Johnson, or is still being put on hold?
No, Johnson & Johnson is available. The distribution of a vaccine is actually by the state. What they have available, they will release. So you can get the Johnson & Johnson sometimes. Sometimes you get Moderna, sometimes you get Pfizer. So it depends. But the Johnson & Johnson has a lower efficacy, but it's one shot. Okay, so it's only one, and then you don't need another one. Now, there are people who are getting both. They're getting the Johnson & Johnson, then they try to get the Moderna or Pfizer to have two ways of, because the vector is different. And so they're working in a different way, so to speak. But that can happen. And we have some studies coming up that the combination seems to be okay. So the Johnson & Johnson was put on hold because of some problems with myelitis that were completely unrelated to the vaccine. And it happened to many of the vaccinations that sometimes they have one case here, and the FDA immediately would put on hold just to analyze and make sure it's not associated with the vaccine. And so once they demonstrated by third party that they were not associated with the Johnson & Johnson vaccine, they were allowed to bring them back for use.
Okay. So on that same thing, are we expecting to also get a booster shots for those who already had the vaccine? Is there any expectation to have a booster shot in the near future? Yeah.
The answer is yes. Expect that we're going to have another booster. We already are doing the research for the Pfizer and Moderna booster. Pfizer has already vaccinated a bunch of subjects. They're studying. Again, some get placebo, some get the real boosted. As you can see, they're doing carefully, scientifically, blinded, and they will see if it's effective or not. Moderna, we also are going to start doing the boosted. Now, it's not yet approved, so don't go and try to get your third shot. It's not approved. If you try to get a third shot, you're going to appear in the computer they already got the two. So don't try to get the third one. They're going to say, no, this is not yet approved. You have to wait until the FDA approve a boosted vaccine. But yes, expect it, because we're doing it, and we know by preliminary result, they're very good. What it does is elevate your antibody higher, and that is good. That's what you want. So it's coming probably by the end of December or January next year. But yes, it's coming.
Thank you.
Does anyone have any question that you want to ask? You can raise your hand on the chat. Use the raise hand button, and we can give you the chance to ask, please. Okay. Auntie Mickey, go ahead. Sorry.
I have a question for Heidi. It's from Abby Kelly School. That we all know that last year there was a contact tracing by Abby Kelly, Now the concern is as we go back to school for children who have not been vaccinated, is there a chance that these kids are going to be bullied, or parents, are really worried about this? And so this is a question that I have for Heidi.
Sure, that's a great question. So first of all, I think one of the things that parents can do is be in touch with their school and answer the emails, read the emails that come through, get the information. That I can't tell you is how important it is, because we are trying to get information out. But if parents, and I've had many of them say, oh, I don't read your emails. Well, I don't know how else to get the information. I wish I had the time to call 1,426 parents, but I don't. So it is very important to read, regardless of where your child is going, what the information is, number one. Number two, if we are going to continue to do contact tracing. What I don't know, now here's how this goes. We have not received guidance yet from the state on what is going to be a close contact this year. So I don't know if you remember, probably didn't pay as much attention to it as I did, because I was living and breathing this 24 hours a day, 7 days a week last year. But at first, a close contact was someone who was within less than 6 feet for more than 15 minutes. And then they switched it. At the first, it was in a 24-hour period. So I had to come up against another person 3 times for 5 minutes over a 24-hour period. So it was like this weird, like, who's counting how many times during a 8-hour day you're walking up to a person? But that's what they wanted. So then they switched it to say just 15 minutes next to the same person. We had the guidelines change, and we can only abide by the guidelines. So today, right now, I don't know what a close contact is going to be. I don't know if they're going to go back to what was the 15 minutes within 6 feet. So if I was 7 feet away from someone and I only talked to them for 14 minutes, I'm not a close contact. So I don't know what the state is going to say. I don't know if the state is going to say, if you're vaccinated and you had a mask on, you are not a close contact, because now you have 2 precautions. I don't know. So whatever the state says, we are going to follow that guidance. And what we do is, in the case of close contacts, it is not public information. It is not something that people know or share. You will get a call from the school nurse or the principal, and you will be told your student may be a close contact with, another student. No names are shared. We want you to get a negative COVID test, or we want you to stay home and monitor your symptoms, whatever that guidance is, okay? And it will be clear. The nurse will go over it. It will be on our website. I will send it home in emails, so you will know what to expect. What I can tell you is, today at 11:30 this morning, we had a meeting with the Department of Education on testing in school and being able to provide testing to students in school. I know, again, how hard it is to come and pick your student up, bring them to get an appointment, go to the doctor, wait for that result, all the while trying to juggle everything else you have going in your life. So if we can do something here at school to help make one less thing on your list to do, and it gives you very rapid results, or it confirms your child is not positive to COVID and they just have a runny nose and they can stay in school, then I am all for that. But in order for us to do that, we need the parents to read the information and sign off on the consent, because we can't do that without them agreeing to it. And again, we want to be a partner with you in the health of your child. We want to help you when possible, to not have you have to run around to go to a doctor's office or CVS or Walgreens and get a test in order to come back to school. One of the things I do want to say, so please read the information we send out, answer the phone calls if the nurse calls, and sign the consent forms. But the other thing I did want to point out is we are absolutely in partnership. Last year, there was this ability for you to keep your child home, even if they were in school. If they were sick, they could stay home and do school remotely, right? Like nobody missed a beat. You could basically switch between school and home and not have any absences, technically, if you logged on. That is not the case this year. So if you get a call and you are told your child not only is sick and can't come back until they have a negative COVID test, or they're a close contact and they have to be in quarantine until they get a negative COVID test, those days out of school are now counting as absences. You are not going to be able to jump on a computer and just remote into school. That is not an option. I'm not saying I agree with it, but I'm saying this is what the state is saying. There is no remote option. Now, we are going to do our absolute very best to provide work and let the students keep up with their schoolwork. But that doesn't mean they're not going to have an absence for being out of school that day, because there's nothing we can do about that. I will just tell you, the state, not us, but the state says if you are out of school more than 14 days in a year or 18 days in a year, you are at risk of not moving to the next grade, not passing a class. You get a letter. If you can do the math, if you're in quarantine for 7 or 10 days twice, you are now over the 18 days, and it wasn't necessarily because you were even sick. So if we can do testing in school and give your student a rapid test within 15 minutes, realize the runny nose and the sore throat is just a cold or allergies, it's not COVID, your son or daughter was a close contact, oh, nope, they're fine, we're gonna test them. The state is saying every day for 5 days, because we know symptoms show up after a period of time. So we need your permission to help you. That's basically what this comes down to. We can't do this without your consent, but it is something that will absolutely make your life easier about keeping kids home and running to doctor's appointments. So more to come on that. We just learned all this today, but it goes to, I think your point is, are kids going to be bullied? None of that information gets out. That is not, if a student is home, nobody knows why they're home. They're in quarantine, but we don't have to send them home if we do, some of the rapid testing here in school. So that will also help with that. We will not tolerate any bullying, whether, somebody is talking about, are you vaccinated? Are you not vaccinated? We're not going to tolerate any of that. We have a lot of academics to get through and not enough time for all of that stuff. So hopefully that answered your question.
Okay, thank you
very much.
Abby has a hand up. Abby, you can go ahead and ask a question.
Hello. Sorry to interrupt you, but my question is for the Abby Kelly School. With the elementary school, elementary kids can't get the vaccine. So how would the whole contact tracing work? Because my son has more than 20 something kids inside the classroom. And technically, if they're not supposed to be next to each other within more than 15 minutes, how is that going to work?
So that's a great question, Abby, because that's what I'm waiting to find out. So I was using that information because that was last year's information. That's how we made the rules last year, because we were required to socially distance. So if you recall, last year, we couldn't have 26 kids in a class. We could only have half of that, which was 13, because we needed people to spread out, which is why we did the hybrid days where you came in 2 days and then another group came in another 2 days. We know the state is making us have all kids back, and they are telling us, everyone is saying, you should put as much space in between the students as possible, but you cannot make it so that everyone can't fit in the classroom. You have to make sure that everybody is able to come back. So we're going to do some creative things. We used the outside a lot last year. If it was nice weather, we did art lessons outside. We, went outside to read books under the tree to spread out. We're going to do what we can do in terms of the social distancing. But I do not, and I'm going to be clear, I do not think the state is going to tell us that you have to socially distance this year. So they're going to have a different way of determining who and what is a close contact. It's not going to be, were you within 6 feet of this person? Because you're right, we would take out a whole classroom. That's just not going to happen. So they have to come up with another set of standards in order for us to adhere by. Because of these rules. And I will tell you right now, I don't have that answer. So stay tuned. They're supposedly sending this out later this week. I will share it as soon as I have it and be able to answer more questions specifically for this year.
Okay, thank you so much.
Yeah.
Any more questions, please?
Not that I can see any hands up.
Okay, somebody is asking about the antibodies. The question is, how long does this stay in the body, like in terms of we getting the booster? So like, is it that the vaccine that we got, as the antibodies are staying for a shorter time, that's why we need a booster shot for that?
Yeah, so the answer, and that's a great point. I just want to emphasize that the antibody levels that everybody got when they have either the natural infection, which is lower than what you get the antibody when you get the vaccine. So when you get the vaccine, the titers of the antibody, you make much more antibody than the natural infection. Some people say, I already have the infection. Why would I get the vaccine? I already have antibody. Well, guess what? You don't have as many antibody as other people who are vaccinated, so you still can get it, and we've seen it. So we want to make sure that people get higher antibodies to neutralize the virus, and they don't, get so sick or ended up in the hospital. So we don't know, like Heidi was saying, I mean, this is we are learning everyday things, and we don't know how long the antibody is going to last. We know that, and that's why we're doing the study to see about the booster vaccine. But we believe that the booster will protect you even more, specifically with variants that we now have. Moderna is the only one that is already coming up with the Delta variants and their boosted. Pfizer did not put any new variants, but they are going to make another boosted with the variants. So this is a moving target thing. This is changing every day. We have learned tons. We have learned, like Heidi was saying before, we were so concerned about the the environment. It doesn't mean that we should clean or whatever, but not, I used to, when I was went to see a patient, I was like wearing like a really double gloves and super, protected. Right now, it's not like I don't get protected, but I'm not that concerned about the environmental as much as the air. So I think we have time to learn for how long the antibody is going to last. But the booster mainly is because of the new variant. So yes, we have to get that, and we're doing the trials right now.
Thank you.
So the question I have here is, if someone is vaccinated and they get infected, will they need antibodies so it doesn't get worse? That's the question I have.
You mean monoclonal antibody?
Yeah, I think the person's asking in general, if the person is vaccinated and get infected, would they need antibodies so it doesn't get worse? That's the question. I know.
Doesn't get what? I'm sorry.
So the person is asking if I'm vaccinated and I get infected with COVID, would I need antibodies so that the sickness doesn't get worse?
Oh, worse. Okay, yes. So, yes, you can use the monoclonal antibody as a treatment as long as you qualify to get them. Like I said, not everybody are able to get it. It's something that we have available right now in certain circumstances. Right now, we're using for people who are very sick. But yes, we have used people, and there are many monoclonals that are working. There are many types. So there are a bunch of studies right now ongoing. We have at UMass experimental ones, new ones that they want to get the FDA approval. So the Regeneron is one that is already have the emergency use authorization, and that is available. And we have other ones that you can get it if you qualify to get it, meaning that you don't need oxygen and that you can you qualify for the criteria to obtain those monoclonal.
Okay, thank you. There's a question here. So someone is asking about ventilation. I think this one goes to Heidi. Has the school system invested in revamping ventilation? And what is the standard now for HVAC requirements in the school buildings?
Yeah, that's a great question. And I'm sorry, I missed adding that to my list of things that we did to help mitigate things last year. So we are fortunate, not many schools are, but we are fortunate that out of our 3 buildings, our elementary, our middle, and our high school, that 2 of the 3 have air conditioning. So our elementary and our high school have air conditioning, ventilation systems. They are updated, constantly checked, cleaned, absolutely. So we have that more than some other school districts do. Our middle school, however, does not have that right now. And although we are going to be working toward something for a whole ventilation system upgrade, every classroom, we purchased air purifiers. And in some cases, depending on the square footage, how big the classroom is, there are multiple air purifiers that are in there. And so again, no person-to-person transmission last year in any of our schools. When possible, we keep our windows open so that we use that circulated air so that airflow is going through. All of those air purifiers, even though we didn't put them in until I think it was maybe January of this year, so they were only in for about 6 months, but they were all cleaned and sterilized. Filters were replaced, so everyone is starting fresh again for this school year. And it is part of our maintenance to keep that in. So the air purifiers are the ones that were recommended by the state. And I think we bought something like 200 or 300 of them. So we have them in every classroom in the middle school offices. I have them in my office, etc. So that is absolutely air purification, ventilation, our HVAC system. All of those things were updated, cleaned, and in good working order, and have been yet again refreshed for this year. So.
Okay. Any more questions? Anyone else with any question? So my question is, so with the little ones in kindergarten, like I know Abby Kelly has kindergarten, how are you guys planning to monitor with keeping the marks on? Because these little ones, it's hard to control that.
You know, you would think that was the case. However, I know adults, it was harder to keep the mask on than the little ones. Okay. First of all. Secondly, we did this last year, and we knew that parents were going to have that same concern. When the students, like, there's just something about coming to school, and their teachers are phenomenal, and that's the expectation. Just like you raise your hand in class, just like you go to the bathroom in the bathroom and not, at your desk. Like, there are just expectations. And we are fortunate here at Abby Kelly that you wear uniform. And in our minds, the mask becomes part of the uniform. It's, you just wear it. You wear your pants, you wear your shirt, you wear your socks, you wear your mask. And I will tell you right now, I visited those kindergarten students as often as I could, because it filled me up with such joy when I was having a tough day. So I would go down there, and they never, ever had an issue with their masks. Maybe an occasional reminder to keep it up on their nose and not just their mouth, but there was not the level of pushback that I think some people thought were going to happen. And I think I credit our teachers for setting that expectations, but more so I credit the parents for saying, this is what you need to do. You need to go to school, and in order to go to school, this is what you wear. And they absolutely abided by it. They kept them on the bus, because that's a requirement as well. And, I will tell you, I witnessed myself. There were times when we would build mass breaks in, and at the end of the year, if you recall, overnight, they were like, no more masks outside, right? And I sent out this message to all the parents, okay, as of tomorrow, no more masks outside. The kids still wore them at recess.
Parents, are you listening?
They still wore them at recess, even though in mask breaks, even though they were told, okay, we're going to go outside. You can take your mask off, stay 6 feet from your friends. They were like, I'm used to wearing it. I'm just going to keep it on. I would rather go sit and talk to my friend and keep my mask on than take it off and stay away. So, kids are adaptable. And I will say, one of the things that I said last year, they take their cues from their parents. And so you have a very, very strong responsibility to make sure that they are prepared to come into school. We will take it from the door, the front door. As soon as they get off that bus, we will take it. But you can do a lot to help them prepare, and just have that in their mind. This is part of coming to school. I know kids who don't like to wear pants, and they run around all the time at home in a diaper or underwear, right? We got to go out of the house. You got to put pants on. You got to go out of the house. You're going to put a mask on, and that just becomes the norm for them. And we did not have any issues, no discipline issues whatsoever about the mask. So good question.
Thank you.
Thank you.
Another question is, what are the plans for buses, kids getting on the buses? Is it going to be socially distanced, or what is the plan?
Again, yeah, that's a great thing. So last year, again, I can only compare it with 1 year. Wow, it's only been 1 year. It's just hard to believe that all of this has changed in 1 year. So last year, it was one student per seat on the bus. And that was what the guidance recommended. But again, it was this idea that, you know, a whole bus would have to be quarantined if one kid tested positive. That's not the case anymore. So as the year went on, they lifted the guidance on the bus. And so, no, they don't have to be socially distanced anymore. And again, I go back to the state wants everybody in school. So we can't say, oh, we don't have enough classroom space. We don't have enough desks. We don't have enough room on our buses. We're going to have to figure that out. And we're going to have to order more buses if that becomes the case. So right now, there is not any social distancing protocol for the buses. The kids will need to, students and bus drivers will need to wear masks. And, you know, again, I think as they are going to learn in school, let's not be jumping on each other. Let's not be climbing on each other. Let's be sitting in our seats and being respectful of each other's space. And, you know, that's an important lesson that I think just this generation of students are going to be learning. So, okay. But more to come on the bus. That will be something I share as soon as I know more. How many times have I said, I'm waiting for more information tonight? More than I would like, given that school is 10 days away.
Okay. Auntie Mickey, any questions from your side?
It's about last year, I think it's for Heidi, that schools gave out laptops and hotspot systems. And is this going to be the case?
Yeah, that's a great question. So yes and no. Okay, so here's the yes part. We have all those Chromebooks. They weren't thrown away. We have them all. Our older students are going to be using them in class here at Abby Kelley. Our younger students may use them, but they're going to be going back to a traditional paper, pencil, crayon kind of learning experience, especially for the younger students. The kids in middle school, they're going to have a little bit of both. They're going to be our hybrid, right? They're going to have the computer someday and they're going to have paper and pencil other days. Because there's no remote learning, having a hotspot, which is something we paid for hundreds and hundreds of them, is not a requirement of us because we're not asking your student to log on during the day to attend school. So at this point, because the state is saying there's no remote learning, we are not going to be providing hotspots. We will be using the Chromebooks most of the time in school, but if students need them to work on things at home and they have access to do that, they'll probably be allowed to take them home as well. Certainly the older students will take them back and forth. But again, if the state changes its mind and says we can do remote learning, then we are going to have to provide hotspots to families that are in need of them, because that will be our obligation if we're expecting you to teach. So at this moment, no, but it could change like everything else. So, but that's a great question.
So on that, just a follow-up, what was the assessment for last year, remote learning? Was it effective? I know there's a first time trying. How effective was it for the teacher's point of view? That will attest to whether they have to repeat it or you think it was too bad, they should just get back in class.
No. And I can say we did not ask anybody to repeat any grade last year, okay? Because that doesn't help anyone. We know that there is going to be some things we have to make up. And the teachers are aware that not all students learned as effectively online as they might have in the class. But here's what I'm going to tell you. Not all students learn in the classroom the same way either, right? So for some kids, I will tell you, they loved being online. They loved it. They excelled. They were over the moon excited. Some teachers loved teaching that way. So just like everything in life, there are variations. And so I would say overall, it was incredibly successful. And I'll tell you 2 reasons why. Number one, we didn't worry in the beginning of the year about content, meaning, do you know this date? Do you know this information? Did you read this book? We worried about establishing relationships. We wanted to know our students were okay on the other side of the screen if they were at home. We wanted to know, oh, is that a cat in the background, or is that your little brother running around? We wanted to have a relationship. So in some ways, those are things that never get to happen when students are in person in school. Teachers may not never know what goes on at home because of that. So we got to establish relationships. That was the number one priority. And number two, it was really helping in communicating with parents, letting parents know, hey, so-and-so is not really doing his work, not passing it in. He's online, but the computer's here and I can't, he's all down like this all day and I can't see his face and he's not paying attention. And for the most part, if parents were alerted to that information, they made corrective actions at home. I don't think anybody would say we missed teaching lessons. We were behind. We never got to, how to add 2 + 2. Now, it's possible some kids went through that lesson and they still don't know how to add 2 + 2 because remote learning wasn't an effective way to do it. Or the teacher wasn't able to say, are you struggling with this? Because your older brother was doing the work for you. And so it looks like you have the right answer, but you didn't really do it yourself. So we know having students back in class is going to, be able to check in on them for their mental and social health. We know we can establish a, check-in with them. And if they're behind, that is what we're going to do. We're going to have to bring more resources in. We're going to have them, maybe stay after school for a math club or come in early for some extra reading. That is what this year is going to be about. It's going to be about meeting the students where they are and helping them get to where they need to be. And so I think that's really important. If I can just say one thing that we didn't talk about tonight, but I think is really, really important. For some parents, this is the first time their student is going to be in school in 18 months. 18 months, like that is huge. I will tell you, the kids that came back last year, they forgot how to raise their hand to have a conversation and be called on in class. They forgot how to even talk and have sort of dialogue with the teacher because they were so used to being in a format like this, where they got to raise their little reaction hand or they just typed it in the chat, right? Because for whatever reason. So there are going to be some social norms that have to be reestablished by kids coming back to school. But the thing we haven't really talked about tonight is just how they feel, their mental well-being. And I know that in some cultures, that's a really hard thing to talk about, but kids are people, and we all have days when we're not feeling 100%. We're feeling blue, we're feeling sad, we're feeling overwhelmed, we're feeling scared. We may not have the words for that. And I think we're going to see a lot of those types of things in school because they haven't been in this environment for many, many months. And we have extra support. We are going to be working on lessons that talk about expressing your feelings and finding the words and being able to talk to someone. But the last thing anybody wants to see And I can tell you, we heard it, I'm sure the doctor can confirm this, is students being hospitalized for mental health issues because they're at risk of killing themselves or committing suicide or cutting or taking drugs or doing things to lessen the pain. And if we can do anything as a society, we have to help them be able to find a trusted adult, be able to articulate this, be able to share this with somebody who can get them the help. The virus is one part of this, but there is this whole other piece that isn't getting talked about. And that's really just how people are feeling, the mental anguish that is coming out of this, being isolated, being separated from your friends, having lost loved ones, being scared. Who wants to live in a state of being afraid all the time? To go to the grocery store, go to school, who should be afraid to go to school? And yet people are. And all of that takes a toll on us internally. And we can't see that. It's not a cough. It's not a fever. It's not a broken arm. It's not something that you can see, but it is just as difficult and deadly as this virus if we don't pay attention to it. So I'm not a doctor, but I just know that these are things that we have to pay attention to. So as parents, please reach out to your child student. Please say, hey, they're not really feeling themselves. I can't get them out of bed. They're not just being lazy, they're suffering inside. And we have to be able to talk about that in order to find the help. So I'll let the doctor take it from there, but it was something we didn't talk about tonight, and I think is going to be very, very important as we go forward.
I think, Heidi, you pointed something that is quite interesting. Like everything, new changes bring either something good or something bad. We have, and as a human, we have resilient to things, and we will learn from this, and we have learned. I just was watching a video saying what the mask was bringing. The mask was bringing that we are all equal. We are all have to put the mask in, and then we're starting to smile with the eyes, and then we have to really understand that behind the mask there is a person that is suffering too, and certainly we have seen. Now that I treat patients with mental health, but an enormous amount of patients coming with severe, it's like a trauma type of thing. Right. And remember, many parents they lost their job. So the fear of economic and financial, and they have to live somewhere else. I mean, there's a lot of things that this pandemic has brought us, and it will continue to bring. But as we reach out to each other and we, help anyone, remember that many people were reaching out to the elderly because they were even more alone than ever. People were afraid, family were afraid of bringing the virus to their loved elderly. And so they were more isolated. So we have to pay attention to that and try to reach us with compassion as much as we can. Even having COVID, I mean, patients can say, nobody comes to me but the nurse. And they start, and the nurses were so good in trying to provide that care and attention to them as they couldn't get it from family members. So I think we need to continue an understanding. We're learning a lot, and we have to be open-minded, and also by open mind to also understand science. I really believe in science when things are studied in a blind way, and don't believe in social media that's saying things that they're not proven to be true. Remember, we had medications that people were, the hydrochloroquine, they were like, oh yeah, that's a phenomenon, proved to be not good, and so on and so forth. So we have to be very careful and continue to learn from each other. And I think I really want to thank you for doing this, because the more we can inform people about this, the better for the community.
Thank you very much. I have 2 questions for you. And the first question is, are there any vaccines apart from Pfizer that has been approved for children 12 to 17? And then
Moderna will be soon approved for that age. It's a matter of just weeks. So that so far are the two ones. And they're doing studies even for younger, and that is also coming.
Okay, so that brings me to the second question that you mentioned that because of data that was, we had a lot of data, so there could be emergency authorization of the vaccine to be given way before FDA approved it. Do you see it? I know that studies is ongoing for the kids. Do you see us going that way? Are we getting enough information that will enable us to authorize vaccination for kids under 12 years too before FDA approves it?
So the vaccine for that age group has much higher scrutiny, an incredible scrutiny. So that's why we haven't yet, and they want more time. And unfortunately, it's going to take a longer time for the kids to get the vaccination because they're watching very carefully about a lot of things. When we did the study for adults, nobody was measuring the height and the weight. That was not part of our assessment. But in children, they have to be assessed. Is this affecting the growth? If they're affecting other things? So there are much more data that they need to collect. So they're not taking this under the table, under the rock, and just not assessing things. They're doing this. There has never been a vaccine with much higher scrutiny and observation than the COVID vaccine. So believe when we said that when they get the seal of the FDA approved, it's because they have really, really been seen very carefully. And for children, the same thing.
Thank you. Thank you very much. Any
So
more?
we have, okay, Auntie, you done with the questions?
Yes, I was asking.
Okay.
Back to you.
Okay, so we have less than 10 minutes. We're wrapping up very soon. Any last question before I ask Presiding Elder for some remarks before we close? Any question? Please.
So I want to, if somebody has another question in the meantime, I want to assure you, because again, I sometimes they send me some video. Research in COVID is still ongoing, strong, and there are more things coming. And as the vaccine for COVID had made a huge jump in technology because it's a nanotechnology, and the way the liver, the component to make the antibodies beautifully, if you see the design, and this is actually going to open doors for other therapeutic and cancer and hepatitis B and other things that is amazing. The effectiveness for coronavirus is really high. I mean, when we get the flu vaccine, and many people get the flu vaccine, yeah, they only protect you 50, 60% at the most when they match very well the vaccine with the strain that is happening, when they guess what is going to happen. With coronavirus, having 97% was an amazingly super effective. So I think that knowing that, I really sometimes don't understand the fear of people having those who have not been vaccinated to get it. Yes, you're going to have some side effect. I can attest, many who have been vaccinated know your arms hurt, but then in 48 hours it's gone. Some people get for a week pain, really inflamed arm. That's true. It's because this vaccine is reactogenic, meaning that they cause a lot of reaction to it. And then some other people, many get even fever. They can feel like they have the COVID. I got very tired with my second, something that I never had experienced, a tiredness that I couldn't get out. But then, after 4 hours of sleep, I was able to get it to work. And I was like, wow, this is a serious thing, there's been some link, and I want to bring up about myocarditis. Very few cases has happened, which is an inflammation sometimes of the, but it's not enough yet to say that it's caused by the vaccine. More research is undergoing. The same thing with myelitis. Myelitis that made the Johnson and Johnson to put on hold. Some people trying, and it's never been linked to the vaccine. Bell's palsy or Guillain-Barré. And again, there's tons of evidence that there is no link to Guillain-Barré or any other neurologic thing. So like anything, even aspirin can cause an anaphylactic reaction. But when you get a vaccine, there are people who can support you. They can call 911 and give you all the things that you need. So again, it's still safe. And we have vaccinated millions of people, not only in America, but in Europe and South America. And you haven't heard when they said in the videos, people are dying. I haven't seen those deaths from vaccines, so that has not occurred. So there is not an intention to make a race disappear, because that has been one of the excuses for some of my patients. No, they just want to eradicate African American. Like, no, that's not true. That's unfortunately, I understand that historically, due to how it has been treated in research, African American are skeptical in getting the vaccination, but we have to overcome what in the past was horrendous. I'm not disputing the history and the reality, but these days, I mean, believe me, we are trying to get a safe vaccine for African American, African, everybody, Asian, any color, type, and form, and it works. So please get vaccinated.
Thank you very much, Dr. Wosolowski and Miss Heidi, for coming on our platform to speak to us. Miss Heidi, I'll be seeing in school. My child is coming to Abbey Kelly. I think we spoke already in school.
Oh, yes.
Yeah.
And you're going to love it. It's awesome.
And Dr. too, I think I've seen you at UMass a couple of times, so I'm familiar with you. Our leader, presiding order, the same will give us a little remark. Then after that, Sarah will give us the vote of thanks. Presiding order, please, over to you.
Awesome. Praise the Lord.
Hallelujah.
Hallelujah. We just want to thank Dr. Wosolowski and Miss Heidi as well for honoring our invitation and giving us this wonderful wealth of knowledge for us as parents in preparation to bring our kids best to school. Church, we've heard from various angles about the vaccine, and we've gained the knowledge that we need to make that decision. If you're not vaccinated and you're on this line, we highly encourage that you do so. Many of us have vaccinated and we're fine. We don't have any 666. We're feeling just fine. So I know there's a lot of rumors going out there and a lot of things that are being said against the vaccine. So please, we just want to thank Dr. Wosolowski and Ms. Heidi again for blessing us. And we also want to thank and bless the Sunday school leadership, Auntie Vivian, Auntie Mickey, and Uncle Jeff, and all your executive members for putting this together. And I pray that this school year will be a school year and we'll all have be blessed. Unfortunately, our pastor couldn't be on tonight because he's on vacation. So on behalf of the church executives, we just want to say thank you. God bless you and everyone for joining us. Let's pass on the information. And Miss Heidi, as you guys get more new information for us as school gets closer into reopening, please kindly share with us so we can pass it on to our congregation and our community as well. God bless you.
Thank you. And God bless all of you. Thank you for having us.
Sarah.
Bye-bye.
Okay.
Hi. So first off, we just want to thank the Almighty God for bringing us all together today and making this program a success. And also to the leadership of the church and to the district executives, we want to say thank you. And to our speakers, thank you guys so much for taking time out of your day today to come speak to us. Thank you, Heidi, for educating us about the steps the school is going to take in order to minimize the risk for COVID. And thank you, Dr. Meyer, for educating us on the science behind the vaccination. and the importance of us getting vaccinated. And also to the children's ministries, to the teachers, to everybody who just helped make this program a success. Want to say thank you. Thank you to the children. Thank you to the parents. Thank you for everybody for coming on this platform. And I hope today's talk has helped elevate some of our concerns, and we've just learned a lot from it. And as you guys really emphasized, life is about taking risks. So like also taking the vaccination is also about taking the risks too. So why don't we just do it? So thank you guys so much for coming today to talk to us. And thank you everybody for making this program a success.